the document sorter and the AI receptionist work. So let me show you a few sort of, documents. Essentially, all you do is you upload a document. You can browse any documents that are on your computer or something like that, or the really efficient way that we use it at our clinic is via email. So we can set up an email for you. You need to let us know, so you can email hello@mbspro.com.au. I'll show you how to do that through our help section, or chat to us through our help section as well. Either or is perfectly fine, and we set it up for you. I think the email works really good because pretty much gets rid of all downloading attachments from emails and uploading them. We just forward emails to this address, it downloads them, and what it does is it shows you the file here. It matches up to the patient here, so good old Emma Rodriguez, and it'll match it up to specific document type, doctor, and then you can elect to put it into the patient file or the inbox. So what it does is it saves a lot of manual inputting, double handling, makes it a bit easier and a bit more straightforward. We've rolled this out at some really large. Let me just show you or talk to you a little bit about the IVR splits we call. So this is what we do at my medical center. So I'm at Condamine Medical Center. You can give it a call and you'll hear Jane. We're sort of rejigging it. So we're always sort of experimenting to get the right thing. And I think this is what works really well. So what I mean by the IVR splits, essentially when you call into a phone and it might say something like, press 1 to speak to, I don't know, the reception, and press 2 to speak to admin or something like that, right? This is what I think works as a basic workflow for AI receptionists. So you call into your medical center and you might have a message that says, welcome to my medical center, whatever the name of your medical center is. Thanks for calling. We'll be with you in a sec. Whatever you want to say. For example, at our clinic, we say things like, we're doing flu clinics at the moment, or we have a bone bust that's out, sort of public service stuff that we just inform everyone about. So you call in to the medical, we say those messages, whatever we want to say, and then another message will play, and all of these are in the voice of James. So that's the name of the AI receptionist. His name's James. So that people are getting used to his voice, and the message comes up after we've played our initial message. So the reason why I'd recommend something like that, it doesn't have to be exactly like that, but something like that, is just because we've found that if you sort of force patients to go to the AI first, you get a lot of complaints. If it's just as an adjunct to the care that you're providing, you can use James, who can answer your phone calls, do a bit of triaging. So not medical triaging, but triaging in terms of directing people, where there is a way that you can optimize for after hours PIPs with these AI receptionists. So you press 1 to go after James, who's the AI receptionist. He can book, cancel, reschedule, etc. He looks into your BP, so integrated with BP. He knows when your appointments are open, when they're closed. It's all live. For all the people that don't want to speak to the AI, they just hold the line. Let me get rid of this yes. They don't say yes. They just hold the line. They hold and they just speak to a human reception as normal. We've found that to be pretty good. This is a list. I should have put it on a PowerPoint perhaps. This is a list of things that the AI reception is really good at. So it's really good at figuring out patients that sort of just take a while to sort of make up their mind. One thing before I say that, when we say press 1 to speak to AI, we say, if you want, you can press 1 to speak to AI receptionist. We record these calls for training purposes. So we don't record them audio, we transcribe them more technically, you would say, which is what we saw up here with our dummy calls here. So it's just like a transcription, so you can see what's going on. The reason why we do that is so you can figure out if there was an error made, if there was, sometimes patients will say, I said this and the AI said that, and you can go back and look at it and go, well, actually, whatever happened. So things that AI reception is really good at, it's really good at booking, cancelling, and rescheduling. It's really good at talking to the patients in such a nice voice, taking on their concerns. Really good at that for your call overflow, I suppose. 9 o'clock in the morning when you're super busy, everyone's sort of calling in. This can definitely take a lot of that load off. So we're finding that it's saving about 2 to 3 hours of reception time. So that's the call time that it's taking away from the receptionist, which is really good. That means that the receptionist can focus on the patients that are in front of them. So that's helpful. The next feature that we're adding in is just the ability to book more complex things. So booking it with the doctor and then, maybe the nurse after. So, patient comes in for their care plan review, gets a Prolia, so 967-10997, or a patient comes in for an excision, so you might book, with your nurse and your doctor at the same time. So adding in that complex piece. So this will really pull it all together as such. So that's what we'd recommend as a split. Now we can customize this whatever way you want with our telephone provider. So that's AJ from ASAP Tele. If you have a complex system or you have other splits, you have multiple clinics, things like that, that's all certainly possible and can be done. It's just something that we sort of just, customize for you. So the things that we need from you when you first integrate. So if you want to jump on the document scanner, like you can jump on that straight away as soon as you integrate. So it's like a 3-minute process to integrate and you can just jump on it straight away. For the AI receptionist, a couple of things that we need is we need your knowledge base. So everything about your clinic, all the information, etc. So we just send you an Excel sheet and get some information. Most of it is just from your website. And then clinic settings, which you can sort of customize yourself. And then we just contact your IT provider. So if you give us that, that's part of the Excel sheet as part of the onboarding process. We have our customer success manager, that's Maddie. She will meet up with your head of reception, practice manager, whoever, do an onboarding. We'll get your IT details. We'll talk to RJ and set that up for you at the phone line. So that split that we talked about here, where you sort of come into your medical center, go off to James if you want to, and come back to the human receptionist, or however you want. So that's the AI receptionist and the document scanner.